Hello and welcome. Let me start with a surprising truth. It's not fat that making your liver fat. It's sugar. In fact, your liver turns excess sugar, especially fructose, into fat faster than you might think. This hidden process is why even thin people can develop non-alcoholic fatty liver disease and why low-fat diets often fail. Today we'll explore how different types of sugar and carbohydrates impact your liver health and how simple changes in your diet can make a big difference. If you've been focusing on cutting fat, it's time to shift your attention to the real problem. How much sugar is sneaking into your diet every day? Carbohydrates often get a bad reputation, especially when we talk about weight gain, blood sugar, or fatty liver. But the truth is, not all carbs are created equal. On one end, we have simple carbs like sugar, white bread, sweetened drinks, which digest quickly and spike blood sugar. These are the ones that overwork the liver and can promote fat buildup. On the other end, we have complex carbs like whole grains, legumes, vegetables that break down slowly and provide fiber and support metabolic health. The difference isn't just about how they taste, it's in how they processed by the body. Understanding this difference is key to choosing carbs that nourish your liver instead of harming it. Carbohydrates come in many different forms, but at the molecular level, we can group them into two main types, monosaccharides and polysaccharides. Monosaccharides are the simplest sugar, like glucose and fructose, which are found in fruits, honey, and processed food. They are absorbed rapidly into the bloodstream and can overload the liver, especially when consumed in excess. This is particularly true for fructose, which is processed almost entirely by the liver and can be directly converted into the fat. On the other hand, polysaccharides are complex carbs, long chain of sugar molecules found in whole grain, legumes, and vegetables, and some fruits. These digest slowly, stabilize blood sugar, and provide fiber that support gut and liver health. So, what are monosaccharides? Monosaccharides are the most basic form of carbohydrates, simple sugars like glucose, fructose, and galactose. They require no digestion and absorb directly into the bloodstream, causing a rapid rise in the blood sugar. Among them, fructose is especially important in the context of fatty liver. Why? Because unlike glucose, which can be used by nearly all body cells, fructose is processed almost exclusively by the liver. When we consume too much fructose from sugary drinks, fruit juice, or processed snacks, the liver becomes overloaded and begin to convert the excess fructose into the fat. This process, called de novo lipogenesis, is a major contributor to non-alcoholic fatty liver disease. While monosaccharides are naturally present in fruits, they become a problem when consumed in concentrated or refined forms, especially without fiber. Monosaccharides give quick energy, but in excess, they burden the liver. What are polysaccharides? Polysaccharides are complex carbohydrates made of long chains of sugar molecules. Unlike monosaccharides, they take time to digest, which means they provide a steady source of energy without causing blood sugar spikes. You'll find polysaccharides in whole grain, legumes, starchy vegetables, and fiber-rich foods like oats, brown rice, lentils, sweet potato, and broccoli. What makes them especially important is their fiber content, something that the simple sugar lack. Fiber not only slows sugar absorption, it also feeds your gut microbiomes, help control your appetite, and reduce fat up in the liver. While simple sugars overwhelm the liver and promote fat storage, polysaccharides work with your metabolism, not against it. The key message here is that not all carbs are bad. In fact, many polysaccharides are protective, especially when you are trying to heal or prevent fatty liver disease. Fruits are often seen as universally healthy, and while they are full of vitamins and antioxidants, it's important to understand their sugar content, especially for people with fatty liver or insulin resistance. Some fruits are especially rich in monosaccharides like fructose and glucose. This includes grapes, mangoes, figs, cherries, watermelons, apples, and pears. These fruits contain high level of natural sugar, mostly fructose. But it's also important to consider that these fruits can still be part of healthy diet, but in moderate amount and eaten whole with their fibers. But in excess or when juiced, dried, or eaten without fibers, they can contribute to liver fat accumulation because fructose is converted directly into the fat by the liver. Whole fruits are better than juices, and even natural sugars should be moderated when managing fatty liver disease. While most fruits contain simple sugars, some of them also offer a good amount of polysaccharides in the form of dietary fibers. These fiber-rich fruits digest more slowly and do not spike blood sugar, making them more liver-friendly. Their fiber also support your gut health and helps reduce fat accumulation in the liver. Example of fruits with more fibers includes unripe banana, apples, especially with skin, pears, berries like raspberries and blackberries, avocados, which are technically fruit very high in fiber and low in sugar, and kiwis, which are small but fiber-rich fruits. These fruits provide natural sweetness aligned with fiber, which slows absorption and support metabolic health. So, when choosing fruit for a fatty liver diet, focus on those that are lower in sugar and higher in polysaccharides. They satisfy your sweet tooth without burdening your liver. Common foods high in monosaccharides include fruit juice, as I mentioned before, dates and fried fruits, honey, table sugar, high fructose corn syrups, like things that we have in candies and sauces, and sodas and sweetened drinks. Foods high in polysaccharides are whole grains, legumes, vegetables, unripe banana, whole grain breads, potatoes, nuts, and seeds. Healthy carbs support liver function, regulate blood sugar, and help prevent fatty liver disease. As I mentioned before, best choices include whole grains like oats, brown rice, fruits, especially ones with high fiber content and low fructose content, like unripe banana, apples with skin, and berries, vegetables, especially leafy greens, and sweet potato, legumes like lentils and beans. These foods are rich in fibers, antioxidants, and have a low glycemic index, reducing the burden on the liver. Avoid refined carbs like white bread and sugary snacks, which can contribute to fat accumulation and insulin resistant. So, some tips for reducing sugar. First, read labels for added sugar when you are going to buy anything. Replace soda with water or any kind of tea, and choose whole fruits over juice. Your liver works hard every day, supported with wholesome fiber-rich carbs from nature. Choose whole unprocessed food over refined sugar, and you'll fuel your body while protecting your liver. Small changes, big impact. Start today for a healthier tomorrow. Understanding the right carbohydrate is a vital step toward better liver function and overall well-being. For more evidence-based insights into medicine and health, subscribe to The Art of Medicine from Anatomy to Diagnosis and stay informed with concise, expert-led content designed for everyone. Thank you.